Hi everybody, this is Dr. Sujata Nair from Anatta University. For those who are new to this webinar, we have been doing this in the first lockdown also. Anatta is a Uber luxury rehab facility for those suffering from addiction to alcohol and illicit drugs and prescription medication. We are a single client facility. We have our places in destinations which are suitable to the client, mutually decided by us. The unique feature of our program is that we accept only clients who come in of their own volition. We are predominantly non-medical in nature, wherein medicines are used only during detoxification. The rest of the program, that we use eclectic counseling methods, meditation, other alternate therapies to get the individual back to life. Freedom being the baseline of our treatment process. We incorporate living a regular life away from the substance in a conducive environment with experiential counselors that stay and travel with the client, providing individual care, being available to them 24/7, so that they reach a stage within themselves of not finding the need to use. Anatta Speaks has been an initiative of Anatta University to spread awareness amongst people about the right solutions of treatment present and available in this field. So in that context, we are here now with introducing doctors from different professions, from different faculties, and to speak and to help us to motivate a client into coming into treatment. So today we have with us Dr. Pradyumna Mamtora, who is an orthopedic surgeon. And today our topic is addiction and orthopedics, how it affects bones and muscle health, how addiction to substances, especially alcohol, affects our bone and muscle health. And Dr. Mamtora is a very senior orthopedic surgeon. He has a very conservative approach to treatment of musculoskeletal disorders. He has been in the teaching facility and teaching field since more than 3 decades. He was also my professor of orthopedics back when I was studying in college. And Dr. Mamtora, the very unique feature of him is he's very open to alternate therapies like physiotherapy, yoga, and homeopathy in the treatment of musculoskeletal disorders. He himself is a yoga practitioner and a meditator, so you can see he already has a halo around his head. So let's start. Hello, Dr. Mamtora.
Hi, good morning, Sujata. Good morning, everyone. Thank you for calling me here. Thank you. Let's start.
You're welcome.
Shoot.
So let's start. Yes. So in your past experience as an orthopedic surgeon, in your entire career spanning so many decades, have you come across patients whom you feel, definitely seeing their overall ailments and what they present with to you, that they definitely are addicted to alcohol or some substance, but they have not been forthcoming to you, or they have been denying it to you? So would you share on that front?
Yeah, in fact, yes, we have had, in the whole of these years that I've been seeing patients, multiple ways that I'm talking alcohol more specifically, yes, but other substance abuse also. I've seen that I'll enumerate a few so that it starts the ball rolling. I have seen people who come to me with frequent falls, and I'm wondering why would he be coming so frequently. And then when you go deeper into the history, talking to their family or talking to themselves when they are a little open with, you realize that in their intoxicated state, they lose their balance and have frequent injuries. The other things that I have seen is frequent malnutrition, because they are not very keen on or they are not even aware that they have not had adequate nutrition because of their inebriated state on a repeated basis. We've seen peripheral neuropathies, we've seen muscle wasting, to that extent that I've seen times where the immunity has gone so down with that malnourished state that we found multiple abscesses in different muscle groups. And we needed hospitalizations and multiple surgeries and intravenous antibiotics. Very frequent alcohol abuse that orthopedically I have seen is avascular necrosis of the femoral head. I have seen bone health deteriorating, what leads later on to osteoporosis. because
Hmm.
they are not very active physically and tend to have these poor muscles. The poor muscle mass and the poor exercise pattern ultimately leads to wrong postures, and that leads to degeneration of the spine and joints. So I mean, it's a gamut of things that is happening all over the musculoskeletal system. And
Right.
people who suffer from this addiction are not just suffering from the addiction part of it, but these side effects themselves can be quite debilitating, very, very debilitating, in fact.
Right. So, doctor, how would you describe, say, why does muscle wasting happen in people suffering from alcoholism? Because I've seen a lot of muscle wasting in our clients who have an alcohol issue. So, why does that happen? So, if you could elaborate on
So, so these are two, three factors on it. One is the malnutrition part of it, because they
it.
tend to have that inebriated state. They don't eat well. Whatever they are eating may not be a balanced diet, and their protein intake goes down. Other thing is, because of
Okay.
the regular inebriation, they tend to not work or not do the physical activity, and that leads to the muscle wasting. I mean,
Hmm.
that would be for anyone who has got a very, very non-physical kind of work related situation. They also undergo muscle wasting, but people with alcohol abuse and all tend to get it worse because they just don't realize that they have not worked that area, they have not moved that area. So that, and to a certain extent, the whole metabolism is going in the wrong direction. So the whole metabolism going down brings down the protein metabolism also.
Hmm.
So that's how the
Right.
muscle wasting takes place.
Okay. So then you mentioned something like you mentioned that B12 deficiency grossly affects the skeletal health and the muscular health. So could you elaborate on that
Right,
also?
right.
B12 deficiency because
Yes, yes.
consequent to alcohol consumption long term.
Yes, right, right. So it is a known phenomenon that alcohol can induce a
Hmm.
B12 deficiency, and that B12 deficiency will lead to what is known as peripheral neuropathy. Peripheral neuropathy can be quite
Hmm.
debilitating because that makes you feel very poor at the sole of the feet, and
Hmm.
they tend to lose balance. They tend to feel not confident of walking, and that also leads to falls. Peripheral neuropathy by itself, that tingling, that burning sensation, can be itself very, very unnerving, so to say, and the patient is quite disturbed about it. Peripheral neuropathy is an extreme thing. There are still more deeper things known as cord degeneration, where the spinal cord undergoes a degenerative change, and that is totally irreversible. We really always are scared to make that diagnosis, because that's like we can't go further beyond that to treat. On a routine basis, lower B12 will lead to poor memory, poor neuromuscular coordination, and a sense of irritability. All these things can happen due to low B12, which is connected to long term alcohol intake. Same way, lowered B12 leads to the muscles and the nerve coordination reduced, which then leads to pain, discomfort, stiffness. So that would be from the
All
B12
right.
perspective.
Okay.
Yeah.
So all right.
Yeah.
So B12 also results in consequent D3 and calcium deficiency also, right? Deficiency in B12. It's all
No,
connected
no, no.
in
So they
one.
are connect. Yeah, so they are connected, but it is not because B12
Yes.
went down that the D3 went down and the calcium went down.
I
It's
agree.
like
I agree. I agree. Because of the
because
alcohol consumption.
right. So what happens is they are not exposed to sunlight. They are
Right.
usually indoors. So lack of
Hmm.
exposure to sunlight will lead to the vitamin D not being formed on the skin. Or those who are not on alcohol but are not going to out on the sun, they do vitamin D deficient, but they are a little more health conscious and they will take vitamin D supplements, whereas those persons who are now addicted and are not so much health conscious, are not exposed to sunlight, and are also not taking vitamin D supplements, leads to vitamin D deficiency. Vitamin D deficiency leads to calcium depletion in the bone. Vitamin D deficiency leads to reduction in the muscle activity. You already have a B12 deficiency, now you have a D3 deficiency. So your entire musculoskeletal system goes for a toss. You get these aches and pains which you feel is because of tiredness or because you had a fall, but actually they are low vitamins. They lead to what we term as a proximal myopathy. So their ability to get up from the ground becomes reduced. They tend to have these muscle function going down. So they feel that they are not energetic enough. They feel that every body part is aching, paining, and the level of activity or the level of strength that they had initially is now not happening. And all these lead to a further depletion of the mental state. I mean, you feel depressed about not being able to so many things. And then that depression can lead you to increased alcohol consumption. And then that cycle just continues. That's a vicious cycle the
Right.
person sets into.
It is a vicious cycle that happens, because then they unfortunately think that having some amount of alcohol will make me feel a little strong again, which is actually an illusion. Though, because alcohol, though it acts as a mild anesthetic to reduce pains, it only worsens the situation.
Correct.
So Dr. Mamtora, what you just shared, in fact, is very enlightening, and I'm sure those who are watching will find it to be very uh, adding to their knowledge base and increasing an awareness that okay, consumption of alcohol, long-term consumption can lead to these complications also, which one needs to be
And
very aware of, especially the
yeah, so,
family
so, so
members of those who are suffering. Yes, sir.
correct. So that they need to be, you need to have their supplementation on. I mean, by the time they are
Yes,
out of the addiction thing, but at least there has to be a supplementation going on for the D3 and the B12 on a regular basis. They need to be put on some exercise program so that their muscle wasting does not go worse. They need to make sure that
right,
there are basic posture awareness so that they don't cause more damage to their already existent degeneration, which is on because of so many factors.
right.
The
But
vitamin D
what I have
deficiency, when it goes too low, I mean, a persistent vitamin D deficiency leads to what is termed as osteomalacia. Osteomalacia is not a very regular feature, but amongst alcoholics, it can be quite a bit, because the osteomalacia can lead to what are known as pseudo fractures, which then can ultimately lead to pathological fractures. So I have seen patients who are bedridden because of this osteomalacic fractures, and that can be, it takes months to heal. It takes months to heal.
right,
So it's very
and they are
important
unable
that
to stop drinking.
absolutely it's proper bedriddenness. I mean, there's no way they can get up also, forget about walking around within the house.
Hmm.
So that is
Hmm.
of course a very extreme situation, but point made is, when you are into these kind of small things which add together, if not taken care of, can lead to such large things. Same way the
Correct.
alcohol intake is known to raise uric acid. Raised uric acid will tend to settle into crystals around joints and give you aches and pains. So that can lead to again another episode of depression and saying, this keeps on paining, and that I keep on getting pains here, I keep on getting pains there. There are times where people who suffer from gout, with even a single peg of alcohol, they can tend to get an acute episode of gout the next day. That is the level of connection.
Correct. And to share something, doctor, one of my clients, what happens is the continuing consumption of alcohol happens when it is an addictive phase with all these ailments in the background. So one of my clients, of course, when they come to us, the alcohol is stopped, and during the detox phase, the withdrawals are experienced, and all these separate different aches and pains seem to surface at that time. So one of my clients came and told me, see, when I was drinking, I had none of these issues. Now that I have stopped, all these issues have come up. It's like, that is the addictive logic, not realizing that it is the alcohol that has already led to all these things, and it's not because you stopped that these have surfaced. That awareness takes some time to set in. But that is the addictive logic, which works in a very different manner compared to regular people, wherein there's always a justification for the drinking.
Yeah,
So,
absolutely. In fact, in connection with that, I had one patient who was my regular patient,
uh,
And he also used to consume alcohol, and he had this raised uric acid, and he would suffer from gout. So I used to give him this chart of what not to eat and what not to drink and all, and where I would mention that alcohol is zero. So the last follow up, which was many years ago, he said, "Saab, मैं आपको छोड़ दूंगा, alcohol नहीं छोड़ूंगा." And literally, he left me. He didn't follow up.
Oh, I
So
agree.
the
That is
point
the
made is, yeah, that's the level of trouble that they go through, and they feel that, well,
yes.
alcohol was good enough.
Yes, because one experiences all these pains and all these physical sufferings when one is drinking, but one does not want to drink in that manner, because addiction, in by the time the alcoholism reaches the stage of addiction, one is not drinking the way one chooses to. One still wants to be a social drinker, but is unable to do so because it is the alcohol that is controlling the individual. And at that time, the person is at a loss to understand, I want to stop this, but I do not know how to stop it. So that is where a residential rehabilitation facility comes into the picture, wherein taking that person away from the so-called triggers around and giving the person the time and space required for oneself and regain one's own health, original state of health, and state of health of body and mind. And with people who have been there, done that, gone through treatment, and are living a great and fulfilling life today. So that helps a lot. That is where the residential program helps, wherein you are surrounded with people who know what you have gone through, who understand you.
Correct.
So it's easier for you to get out of it with their help, because the work is done by the client himself or herself. We are only facilitators in that process. Let's put it like that.
Correct.
So
Correct.
yes, absolutely. So, doctor, you had mentioned that you have seen very frequent fractures in people suffering, and you have felt that okay, there is probably a connection to these frequent fractures to consumption of alcohol. Again, as I said, many times they are not open with you about their consumption or quantum of consumption, wherein
Correct.
actually the family comes into the picture in sharing
Correct.
that with you. So, could you
So
elaborate on that?
so yeah. So sometimes it may not be fractures, but injuries is what I would say.
Okay.
I'll give you an example of a person who's been coming to me for many years now. So
Mm,
one day he will come with a pain in the rib. After
mm,
2 3 weeks, he'll come with a pain in the elbow. Some third time he'll say, I sprained my ankle. And over a initial few times, I was thinking, well, this guy is just plain unlucky that he's getting so many injuries. But I would wonder, why would he keep on getting such injuries? And then when I kind of probed a little bit more, and when I talked to the family, I realized that he tends to say that I don't drink much, but he used to consume alcohol every single day. And at times where he would return home late, he would be found on the floor by the wife or the son. And so then that's how we connected all the parts and said that, well, this is actually, he loses balance when he's in inebriated state, and he tends to knock himself down, sprain an ankle, hit the rib on the side of the bed, or whatever, multiple ways. So from there comes the situation that, look, boss, every time you are injuring yourself and you are not being able to go to work because of that injury, you need to understand that the cause has to be treated. Each time I'll treat the fracture or the sprain or the ligament tear or the periosteal injury or a hematoma which has taken place. But why should it happen so frequently? It is because you lose balance. Why do you lose balance? Because you are in an inebriated state. So can we not look into the original cause and try and treat that? So
right.
that's how. And yes, even I mean, there are times where they are open to that suggestion and they said, okay, I will make an attempt. But there are times where they
Hmm.
totally denied, saying that no, I'm sure someone pushed me. No, it was just that there was a wet floor and I didn't realize. And they just refuse to accept that situation. So that those areas, we can't really be much pushy about it, because then they become aggressive to their family members when we tell them to get pushy.
Correct. So that is where the family plays a huge role in helping the person who's suffering from addiction to come into treatment. So where we at
Correct.
Anatta also work with is that treating the family is of equal importance to us, because they are the ones who are watching their loved ones suffering, going through the suffering of intoxication or being inebriated throughout the day, wherein their health, their work front, their family relationships are affected. So the family members who live with that particular person are also affected emotionally. Their lives are equally impacted. They might
Yeah,
not
yeah,
be directly responsible for it, but it is definitely impacted. So we at Anatta, many times it has happened that the family comes to us for help, approaching us for their loved one, and we guide them, we counsel them and guide them into how to get that individual to speak to us once, because speaking to a person with experience in the field helps in motivating that individual to come into treatment. As you said, you have tried in showing that many times they just deny that they have a problem with intox with alcohol. However, when they
correct.
speak to someone who has been through that journey, they
Right,
become aware that yes, A, I have a problem. Definitely, it is right in my face. This person is showing it to me. And not only this person is showing it to me, my own life so far is very self evident of that fact. B, this
correct,
person who is across from me has been through what I have been through, hence understands what I have been through. And probably because he's fine today, if I do what he has done, I might find a solution to what I am going through. So it acts as a motivation factor over there. So guiding such individuals to probably an addiction counselor and someone who can guide the person into treatment, or the family, guiding the family would be a good idea, would be a good option uh,
correct.
to do. Doctor, one of our viewers, Kinjal, has a question which I would like to ask you.
Yeah.
She asks that what amount of alcohol is detrimental to bone health or affects bone metabolism and the muscles, and what disorders can be seen accordingly?
So I don't think there is a specific amount. It is alcohol is detrimental. I mean, as I said, people with gout, even a single peg today causes an acute exacerbation of gout tomorrow morning. So I don't think you can have a situation where you say that 60 ml per day is good enough or 30 ml per day is not so detrimental. I don't think I can quantify there. Uh, each body's metabolism is different. Uh, Someone with alcohol intake on a regular basis may never get AVN, and someone who has just started binge drinking can get a AVN. A third person may have been consuming alcohol every single day at 60 ml per day, for example, may have developed peripheral neuropathy, and another person in front of him who's had a totally uncontrolled behavior in terms of consuming alcohol may not have had any musculoskeletal problem, but may have ended up with a liver damage. So I don't think for a musculoskeletal health there is a specific amount of alcohol which says that this is what you don't take. Bottom line is zero intake is better.
Right, doctor. I guess that answers even Dr. Nishit Chandra's question that does it apply to all alcohol consumptions or it happens only in cases of excess consumption? I guess that answers that question too. Now, Vandana has a question to ask that
Yes.
if you have a drinking problem, accepting it is liberating. How would you like to elaborate on this so that the individual and the family finds it easier to approach and look out for help?
Acceptance on a larger scale is the bottom line of our humanity, I feel. I mean, if we are able to gracefully accept what is wrong, that is the start of trying to solve the problem. And to a certain extent, acceptance also helps to allow you to recover better. First is if you accept that the trouble starts because of my abnormal behavior. Now, that abnormal behavior would be in terms of excess alcohol or some other drug abuse, or not being disciplined enough to do, say, take the supplements or do the exercise or do the regular treatment that is asked out of me. If that acceptance starts, then you know that where the trouble is. Once that trouble is quantified and the acceptance of that trouble is then the onus of change lies within you, rather than saying that, "Arey, give me a medicine which will cure this. Arey, give me a shortcut, fatafat, which will solve this whole thing, and I don't want to go through all this rigmarole." So there, that is the non-acceptance part of it, and that's more painful. From the yogic perspective, if you see, it is said from the scriptures that graceful acceptance is freedom, whereas non-acceptance is pain. And this is very, very true at all aspects of life, and definitely in terms of orthopedic disorders. We've seen this happen so often. And those who have been able to come to that mental state of acceptance have been seriously liberated, in this sense that right then their direction changes. They are then able to take the help, then they are able to change the behavior that they need to, then they are able to take the right kind of doses of the medicines that are accepted, what are going to help them. They will be doing the right kind of, say, physiotherapy needed, or say they need a plaster for that injury, or they need a bed rest for that kind of problem. Whereas that non-acceptance will say, नहीं 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 ये सब नहीं चलेगा, मुझे तो I need to go to work, नहीं 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 ये नहीं चलेगा, I am not very comfortable with this brace. So yes, acceptance is the bottom line for any improvement in a person's condition, be it orthopedic disorder, be it alcohol abuse, be it negative state of mind. That's where the start is, and once that start happens, in the real sense of it, the change is always positive.
Yes, doctor. So that is so beautifully put, that the onus of change comes on oneself when one finally accepted the problem. So that is what we see so beautifully in our clients also, who have accepted that they have an issue with alcohol consumption, long-term issue. Once they have accepted it, they then seek help. And they accept help also, because they also realize simultaneously that I cannot do it on my own. I have tried multiple times to do it on my own, but I have been unable to do so. But if I accept the help that is available to me, then maybe I can get beyond. But that acceptance is of moot importance, wherein then one can assume responsibility also for the change that is required, that needs to follow.
Correct.
Thank you, doctor. That was a great revelation, I'm sure, for all our viewers who are listening and watching us at this time. Another thing that I would like to ask you is that there have been a lot of hormonal imbalances that have been seen in our clients, like estradiol and testosterone imbalances, which have orthopedic effects. Could you elaborate more on that? Because this is a factor which is not very commonly expressed or understood by people.
So, I mean, look, the male hormone and the female hormone both have positive effects on the musculoskeletal system, both for the males as well as the females. So, if you look at the testosterone levels are going to help in males the level of their bone strength, the bone quality, and to the level of their muscle strength or the muscle mass. So, if the testosterone level goes down due to chronic alcoholism, that obviously will reduce the quality of muscle and the quality of bone. Same way, estrogen is known to be protective to women in giving their bone health. And that's why you see in ladies after menopause, they undergo what is known as a postmenopausal osteoporosis. So if a lady has a reduced estrogen due to non-menopausal causes, in which, say, alcoholism is part of it, then obviously she is undergoing a osteoporotic kind of change much earlier than her post-menopausal state would give. So from that comes the part that we discussed earlier, one of those points that I said, that alcohol is known to reduce the bone density.
Right.
So osteoporosis is a state where the bone health, the quality of bone goes down. The bone microarchitecture undergoes a change in a fashion that it becomes more brittle. It's not like you're walking and you crumble with your bones and you will get multiple fractures, but your bone is now more prone to develop a fracture when you fall compared to sometime when you same fall in a state where you are in a good bone health. So alcohol will reduce bone health, lead to osteopenia, and prolonged osteopenia will lead to osteoporosis. Osteoporosis, osteopenia are these microarchitectural changes which take place and which reduce the ability of the bone's shock absorption capacity and hence make them more brittle, and hence in a fall, not that every osteoporotic person with each fall will develop a fracture, but when your bone has become fragile, your ability to sustain a fall without a fracture goes down. So you develop what are known as fragility fractures. So this is an indirect connection, but yes, there is a connect, and it is a long-term connect. So in fact, say suppose there are people who are social drinkers who have definitely not been into alcohol abuse, but have come to me for osteoporosis for some other reason, be it postmenopausal, be it some other causes, and we have to start treatment of osteoporosis. We do mention that please stop alcohol intake, please stop smoking, because these are detrimental to the bone health. So this is how the connection is, and once you get into osteoporosis proper, the treatment is very long term. You need to take medicines and supplements for years, So I think a preventive approach is much better than a treatment approach. It's not that it can't be treated, but once you get proper osteoporosis and you need proper treatment for it, then that treatment is not small term. It's then you're talking about 2 years, 4 years, 10 years, that kind of a long term thing. And I don't think that is very, I mean, most of the people find it very boring. Very boring. अरे यार ये रोज का क्या चक्कर लगा दिया आपने सर, ये बहुत बोर होता है, अरे मैं भूल गया बीच में, अरे हाँ लिया था लेकिन 6 महीने से अभी नहीं लिया हूँ, अभी बहुत बोर होता है, and then the whole thing again reverses. So the whole point is, can we prevent it? And in that prevention, yes, stoppage of alcohol is a important criteria.
Correct. And it's not just stoppage of alcohol, because stoppage of alcohol is easy. It's about not getting back to it again, more importantly. Correct. And that is where the help of rehabilitation process comes in. Because Absolutely. It is not about drinking or not drinking. It's about not finding the need to do so. That is the Correct. Ultimate goal of living and treatment. So thank you, Dr. Mamtora. I guess that answers even a lot of questions which have come up, like Mr. Suresh's question, what are the effects of long-term use of alcohol on bone tissues? You just very elaborately and very beautifully answered that part of the story. There is another question that is coming up, that what is the optimum level of D3 for an 82-year-old? This is just Mr. S. Kumar Shah who has asked this question.
Right. So the D3 levels for any age group, it's not just 83, for any age group, ideally is between 50 to 70, but up to 30 is absolutely acceptable. Less than 30 is definitely not acceptable. So ideal thing for Indians is 50 to 70. Up to 30 is allowed, but less than 30 is definitely not allowed. But I'll tell you what, yes, we now have very easy access to vitamin D levels, and a lot of my patients want to do it, and a lot of my patients insist on getting it done when I am asking them. So now, you know, though I used to ask it sparingly, now because of this kind of phenomenon taking place where everyone wants to know their vitamin D levels and want to know that and then only start their vitamin D supplements, I also give in and say, okay, get your vitamin D done and we'll see that, you know. But for a general person with or without alcohol abuse, it's always better to continue taking vitamin D supplements. You see, to get a natural vitamin D, you need 30 to 40 minutes of sunlight exposure on your bare back, on your bare skin, between 10 a.m. to 2 p.m. We are talking of Indians. Understand, our skin, the way our skin is made, this is the amount of exposure of sunlight needed to get our daily vitamin D. Now, how much of our people have that kind of time, that kind of commitment? And after all that, do we have that kind of situation? I mean, you open one window or one balcony door to expose yourself, there'll be 10 others watching you. So in an Indian scenario, I don't think natural vitamin D is going to be so easily available. So why not have vitamin D as a tablet, as a syrup, as a powder, as an injection, any which way? I mean, there are multiple formats that vitamin D is available. What's wrong with taking vitamin D on a regular basis? For everyone, people who consume alcohol, people who are properly into alcohol addiction, or even those who have never consumed alcohol. So, answering Mr. Kumar's question would be 82 or 28, doesn't matter. You need to have vitamin D.
Right, doctor. Thank you very much. Which brings me back to a group of our populace, the geriatric group, which is very often neglected, or it's a very baffling group to attend to, even for those in the medical profession. So even those people who are addicted to alcohol who fall into the geriatric capacity, whether male or females, would also come up with a lot of issues which are related to bone and skeletal muscular strength and other issues. Could you elaborate on that, please? Because that is an area which needs attention very much.
So, a geriatric group, any which way, because of the age, have poor muscle function, poor bone health, poor neuromuscular coordination. They, due to other various problems, whether it is a diabetes or whether it is other geriatric problems that are known to happen, will have peripheral neuropathy, may have peripheral vascular disease, may have neurodegenerative disorders like Parkinson's, like dementia, and they tend to have poorer musculoskeletal system trouble, health, which leads them to aches and pains, leads them to falls, leads them to fractures. And on top of that, if there is a alcohol component in it, then obviously the trouble is much worse. So
So,
yeah, sorry, you saying something.
have you come across anyone in your clinical practice who has been addicted to alcohol, other substances in that age group, and have
Yeah.
consequently come upon so many issues?
Yeah, I cannot forget one lady which happened many years ago. She was, I believe, a 75-year-old that time, 75-year-old Gujarati lady, the classic bar type of character.
Yes.
She had come to me with peripheral neuropathy, and she would be in intense burning paresthesia. I mean, she was in hell, so to say, the kind of symptoms she had. So we tried getting all the investigations done. She didn't suffer from diabetes. She didn't suffer from so many other disorders. We went ahead, did an MRI, thinking that there is some problem from the spine perspective and all. Nothing came out. We did a EMG nerve conduction study which showed that it is peripheral neuropathy. And now the problem was, what is causing the peripheral neuropathy? We're just not able to gather that. And to get into that kind of situation where that Gujarati lady, bar kind of girl, madam, bar kind of lady, where could you think
Yes.
of alcohol abuse? Somehow, a
Hmm.
neurologist friend of mine was able to probe and talk to the husband, and we realized that she is consuming a whole bottle of alcohol every single night. Why? Because she gets tired and she is frustrated with the husband. At the age of 75, I mean, it was such a revelation. And the whole diagnosis was, what are we talking about, man? So, I mean, yes, we do get such sudden surprises once in a while. Subsequently, she got better, but yes, I was at absolute. I didn't know why the diagnosis is coming like this, and it was fortunate that my neurologist friend was able to push and pick that out. And we are just not ready to believe that this is happening. Her husband was that Gandhi
Yes,
topi
doctor.
type, dhoti clad kind of one. So there's no way we had thought that this was a diagnosis. But yes, so that comes to the thing that yes, in geriatric also we find these kind of problems. Yes.
Correct. And that brings us to another aspect of addiction in females, because Doctor, it is so unlikely that you say that, you not even have imagined that this woman would have had an alcohol problem. That is the unfortunate part of the story where females who are addicted to substances are concerned. Because of the stigma, which is anyways there across the world related to addiction, I would not say it is exclusive to the Indian society, and especially where a female is concerned, the stigma is so much that they manage to hide the addiction for so long. In fact, we have had
Correct.
clients coming to us with addiction to alcohol, females who have come to us for first time treatment in their 60s, 62, 63, 64, 78 also. So
Wow.
we have treated clients who have been of that age, and I would definitely, I'm very happy to share that they are all sober and doing well today, several years down the line too, because they just
Wow.
need that help. Yes, and it was
Correct.
great that even at that age to come up with the courage to accept help first,
Correct.
and
Correct.
and for the family to support them, and then receiving the help, and they just needed that, and they are fantastic after that. So that is also. And have you come across females who are definitely addicted to substances, not necessarily only alcohol, but
Yes.
even some opioids or prescription medicines,
Yes.
and have
Yes.
developed some neuromuscular or orthopedic issues? Could you please elaborate on that?
Yes. So I have ladies who are addicted to either prescription medicines or painkillers or alcohol and opioids. And the worst part is they come with whatever musculoskeletal problems. Uh, we are unable to help them to reduce their pain because their system and their nervous state is so much addicted to those drugs that the routine drugs are of zero value to them. They just don't have any relief of pain, and that
Hmm.
leads them to taking those things more, and it becomes very
Right.
difficult for, unless they say that they want to come out of it, the problem then becomes of the family as well. I mean, of course, we are in the quandary as to which drug to use because no drug seems to be working on them, since they have already been taking very high doses of those medicines or of a opioid. I had a lady who, you know, she was supposedly well read, but into this. And she would say, "Well, doctor, you are giving me chemicals. I don't know to take chemicals. I would go to the nature and I would rather consume weed and relieve my pain." I mean, so you understand what
Right.
I'm trying to say is that you end up
Yes.
saying that, all right, I mean, I'm sorry, unless you want to change, I can't really make. I mean, I've written the prescription, but she refuses to take that, saying that this is better and that's more natural. So,
Now that is another myth. That is another myth that needs to be busted, that weed is natural, marijuana is natural. Yes, I'm not disputing that the cannabinoid component of marijuana helps in pain relief, helps in extreme cases of cancer-related pains. However,
but that
the
is monitored.
justification used, that is monitored, yes, medically monitored and under a
Correct.
medical prescription and supervision.
Correct.
Unfortunately, those who would like to use weed on a regular basis use this as a justification to use it without understanding
Exactly.
that it has a very strong addictive component. It might appear to relieve the pain, it might appear to relieve the underlying anxiety probably related to the pain, but eventually it creates more anxiety, it creates more paranoia, and gradually increases the pain because there is a threshold that the body has
Correct.
to any substance, after
Correct.
which the
Correct.
quantum of
Absolutely.
consumption will only increase. So that is one thing that people need to be aware of when they are using weed and
Correct.
marijuana
Correct.
like substances.
Yes. Yes.
Absolutely.
Yeah.
Yes, doctor. So tell me something. You had mentioned a few times in our conversation, we had a mention of avascular necrosis. Now, could
Right.
you, this is a purely medical term, so hence for the sake
Yeah.
of our viewers, could you please elaborate on how alcohol
Yes.
or excessive or addictive consumption of alcohol is related to the same, and what exactly is avascular necrosis, and how is alcohol linked to that, alcohol consumption linked to
Right.
that?
Right. Right. What is avascular necrosis? Our hip joint is consisting of the socket and the ball. Right. So the ball and the socket gives us this three-dimensional movement.
Hmm.
The ball is a spherical structure, and it is being given circulation from down, which goes here, and then there is this is a end. There is nothing further. And other places there are like suppose at the hand there will be artery from there also, artery from there also. So you have a multi-system, I mean multi-directional circulation. Whereas from that ball, it's an end artery, as we say. From here it
Hmm.
ends here. So with alcohol consumption, there is some metabolic changes which I don't want to go into details because that's too complicated.
Hmm.
Uh, the small cells within the marrow, uh, which are being supplied by those capillaries, undergo some changes, and the vascularity, the blood supply of that area, depletes to that extent that it becomes avascular. There are certain zones where there is zero blood supply reaching the head of the femur, the circular part of the bone. And consequent to that, there is a change which takes place where the body tries to heal it. But what it does is it in effect creates a change in the substance of the bone, which makes that bone weaker, and that creates small changes which make the spherical head flatter. So the smooth movement which was taking place now undergoes that little jerky kind of thing, and this leads to pain, swelling, stiffness. This is known as avascular necrosis of femoral head, or in short AVN. And AVN can be very debilitating. The AVN can cause you pain lasting years. And there are different stages of AVN, stage 0 to stage 4. From stage 0 to stage 1, the pains keep on going, and a lot of times patients don't even realize that. Stage 2, stage 3 is when they start realizing quite a bit of it. There are two types of surgeries needed in most of the AVN. From stage 0, 1 and 2A, you need what are known as forage surgeries, where the original head is preserved. Stage 3, we can't do anything. We have to wait till it goes to stage 4. And stage 4, we need to do a total hip replacement, which is a very major surgery.
Right.
So we cannot afford to have an AVN, because once you get into AVN, it's a very long kind of disease, which takes a long time to recover. And even if it recovers, it leaves behind a lot of after effects, like you will get repeated pains off and on. You may get into the next stage at a later date. And stage 4, which is the end stage, is a total hip replacement. So total hip replacement is a supra major surgery and also a costly surgery. So yes, if alcohol consumption is on, AVN is a possibility. And if AVN happens, you are looking at a long-term disability, long-term loss of work, and definitely lots of money.
Right. So definitely prevention is better than cure. So if one is suffering from a long-term consumption, addiction to alcohol, it is very essential to accept help at the right time to prevent such complications that could happen.
Correct.
Doctor, another aspect that comes to mind is the young people who are very conscious of their health and who go to gymnasiums and to work out, to do weights. They very often, in order to bulk up quickly or to increase their muscular strength or muscle mass, being young, it's like a showing off of their physical strength,
Yeah.
often get trapped into the vicious cycle of using steroids for the same. So they do seem to bulk up, but somewhere you come across that they are prone to a lot of
So
issues
many.
as a consequence, and they
Yes.
also get
Yes.
addicted to it. So, according
Correct.
to you, what would be the effects that they would face because of steroid use on their body, not only physical but also mental health? Could you please elaborate on that? You would
Right.
definitely have come across many.
Right. So you want to bulk up, you want to look good, you want to show off. There's nothing wrong in that with the age group
Right.
that we're talking about. But there is where natural things would be better off. And that's where you can take regular proteins rather than steroid or taking all those big supplements. You would do a structured exercise program which takes time, not a speed fly by night operator kind of thing where you want to bulk up within few months. That does not last long, and that is not good for health also, both muscle health as well as cardiac health. Coming to taking steroids for bulking up, well, that's definitely out of question, because that may bulk up the muscle that time, but it leads to a poorer quality. Steroids themselves can cause AVN that we talked about from alcohol. I have known people getting AVN with only few days of steroid intake. I mean, it's very, very unfortunate for that person. It's rare to get it in few days, but I have seen that happen too. Just few days of steroid intake and they developed AVN. Now
Wow.
they rue that fact कि अरे मैंने क्यों शुरू किया. But so it's rare to have it in few days only, but it's better not to start. Steroids reduce the quality of the tendons also. They may look bulked up, but microscopically, the myofibrils, the tendon fibrils, and all undergo a wrong change. And I have seen people with these kind of artificially bulked up muscles. Because they are in a hurry to bulk up, their stretching capacity is poorer. And in these people, we've seen muscle tears, we've seen tendon tears, we have seen aponeurotic tears also. So I am of a believer, which these days people feel that I am too orthodox to think about, but I have seen too many injuries, too many complications through all this shortcut fatafat. That is where the trouble lies. We want shortcut fatafat, jaldi अच्छा होना है, जल्दी ये करना है, जल्दी वो बनना है वगैरह. And I have definitely seen muscle tears, tendon injuries, tendinopathies, meaning they may not be proper tears, but the whole tendon undergoes such kind of change that that tendon works poorly and leads to repeated pain in and around those joints where that tendon is involved. So yes, I am a person who definitely tell my patients, stop your steroid use, stop your bulking up thing. You do your bulking up, yes, but have patience, build it up gradually. Take natural proteins, do the exercises on a structured fashion. You need to go from step 0 to 1 to 3, 2 to 3, 4. And suppose for some reason you stopped at step 5 and you are not able to do anything, you don't start again from step 5. Start from step 0, then 1, 2, 3. You may take lesser time from 0 to 5 this time, but don't do this shortcut fatafat thing. I have seen too many injuries, and injury not in terms of a fracture. What I'm talking of injury is you injured your spine, put you on bed rest. You injured your calf tear,
Right.
you developed a rotator cuff tear. I mean, and then that puts a spanner in your works. You'd rather go slow and build up steadily. That will last very long.
Right. Dr. Mamtora, that was a brilliant answer. In fact, I'm sure all the young people who are watching us right now would be thinking twice, 10 times before they consume steroids for bulking up, or even friends who have, or their friends who might be gym goers and all that, they might even help them to, okay, hold on, buddy. You need to pay attention to this. Watch this for more, for a better understanding before you take those steroids. So that's great. Thank you, Dr. Mamtora. One of our viewers, Kinjal, again, is asking a question about what about energy drinks like Red Bull and similar such drinks, these energy drinks that are there around, would they affect muscular and bone health? And if so, how?
Direct connection. Well, all carbonated components are known to reduce the bone density. So that's a direct connection. The indirect connection is because all these energy drinks tend to give you a false sense of security that you are up and about, but actually you have consumed poor nutrition. Actually, your muscle was tired, your body and mind was tired, and you have been flogging a dead horse. So in effect, you are creating more damage.
Right. Thank you, doctor. So, doctor, tell me something. What about the combination of consuming medication with alcohol and drugs? Because a lot of people are on a lot of medicines for their own comorbidities, whether
Correct.
orthopedic or otherwise, and diabetes or hypertension, but at the same time can be addicted to alcohol and other drugs. So, how would you uh, elaborate on that combination? What would be the effects that you have come across?
Right.
Deleterious effects.
So I'm going to talk about drugs where we use as orthopedic surgeons. I don't think I'll be in a
Hmm.
position to comment about the antihypertensives or anti-diabetic
That's
drugs and all
fine.
that.
That's
So
fine.
in orthopedics, where they get into musculoskeletal problems, we tend to use either a non-steroidal anti-inflammatory drug. We may need to use a muscle relaxant, or we may need to use a neuromodulator. Now, all these three association with alcohol can be quite deleterious. Like a NSAID with alcohol can lead to severe gastritis. For those who already are suffering from acidity or ulcers in the stomach, they can have a bad time. When you use alcohol with non-steroidal anti-inflammatory, I'm saying together. Muscle relaxant with alcohol can potentiate the muscle relaxant action, and the patient can feel very dull and drowsy. Neuromodulators, which we use for radicular pains or neuropathies or radicular neuropathies and all, with alcohol tends to potentiate their action, and the person can feel very woozy, very giddy, and can have that imbalance situation and even falls. So those
Okay.
people who are on these drugs and if I know that they are consuming alcohol, I tell them please avoid.
Okay.
Even the social
Thank you,
drinkers,
doctor.
I tell them no. Yeah.
Thank you, doctor. Yes, because this is also a factor which is quite important to be aware of. It is not just about addiction to the substance, but also even occasional use of the substance that can lead to such issues. Dr. Nishit Chandra asks a question that does occasional alcohol intake once or twice a week interfere with vitamin D and calcium absorption?
To a certain extent, yes. To a certain,
All right.
see, as I told you before, also, a single peg today is known to increase the uric acid tomorrow. So
Yes.
each of us are in a band of uric acid. We may be absolutely normal, but that variation takes place. You can have a
Right.
raised uric acid, though within normal limits. So similarly,
Right.
alcohol intake will change the bone health even periodically. Yes, of course. So
Right.
yes, I mean, all the social drinkers and my friends who might be seeing this will be
Hmm.
doing that tomorrow to me. That how the hell can you tell this? But you're asking me a question scientifically. Yeah, the
That is true.
metabolism is
Thank you, doctor.
connected. Yeah, it's connected. I mean,
Correct. Absolutely. Absolutely. So, doctor, coming to the end of our talk, I would ask you a moot question. What would you contribute, or how would you motivate a person who's addicted to alcohol, whom you have become aware of this issue in your patient? How would you motivate the person? How important it is to motivate that person to come into treatment, to take help for the core issue of the addiction, which is
so
causing all the other issues in his or her life?
right. So I mean, I'm fortunate enough now after so many years that more than an orthopedic surgeon, I have become like a orthopedic family physician to many families. So from that perspective, since I know them for years, or even if those who have come fresh to me, but they have known me through someone else, I tell them that, look, those, you have come to me for a specific trouble, but understand the source of the trouble. if you're not going to stop the source, whatever else you do is not going to fructify. I tell them this very regular example that you have a leaking ceiling and you have continuous drops of water falling where you are working. So once you wiped it with a towel, next time you kept a person, third time you brought a machine, fourth time you brought a robo. But what the hell? Why are you spending so much money and getting frustrated? Just go up, stop that leakage, just repair that, go to the source of the trouble. So I tell them that your source of the trouble is your inability to control yourself, your emotions, your depression, and then the need to take alcohol or whatever substance. The source is there. Why don't you change that source? With that source, everything else will fall back into place, because of this, your wife is frustrated, or because of this, your son is not talking to you, or because of this, you are always shouting at people. And then you end up coming to my clinic and I have to give you medicines and you say, har baar kya medicine dete ho? So why don't we go to your base, treat what is the cause, treat the origin. If the origin gets solved, everything else, which is a cascade effect, will just disappear. What is stopping you from there? Those who have been able to get that click and say, ha, have met me after a few years and said, boss, वो दिन कुछ तो हुआ और मुझे समझा कि मैंने कुछ करना था, and I changed that, and now everyone speaks to me well, and now I am also off all this. So yeah,
Right.
and those who have not been able to are still continuing to come to me and keep on wailing on their negative state.
Correct. Correct. That's true. See, very important aspect is that the person. Thank you, doctor, because you have put it so beautifully across that one has to treat the core issue first. Then everything else is only a symptom of that one core issue, which is actually an emotional unmanageability. Which, when one has started consuming alcohol, one feels better with the consumption initially, but then it only proceeds to pain and more pain eventually till it reaches the addictive use, which is extremely painful. Then one needs to use to keep away the pain. Now, treating that core issue of the alcoholism, of the addiction to the substance, and there wherein we are not treating the substance, but we are treating the person using that substance, which is the
Correct.
most important factor that we all need to understand, that it is the individual that needs help. And that is where the right solutions are required to be approached and to be acknowledged and to be used, like a residential program, which is non-medical, which is completely voluntary, because it is extremely important that that individual is agreeable to receiving help, to accepting help,
Correct. Correct.
and also helping the family simultaneously with the family therapy, which is what our program at Anatta incorporates on a whole. It's a holistic program wherein we treat the entire family, including the person addicted to the substance. We, in fact, act as bridges between family members, which relations have been destroyed because of the long-term consumption. So that's how we come into the picture. So, Dr. Mamtora, it was a great talk with you. It was great conversing with you. It was a pleasure to go back to a time wherein I am again a student and you're my teacher. And it was a delight having this conversation. I'm sure it has helped all our viewers who have seen us live at this moment, and also those who would be seeing us later, the recorded version. It has been extremely helpful. Thank you very much, Doctor.
Thank you. Thank you for calling me, and thank you if I have been of help to anyone. It's my pleasure and my honor. Thank you.
Of course you have. Thank you very much.